I am Rotarian or Mosunde Lawson.
It's Ife Yunwarita Ejeze. My friends call me Ife.
My name is Rotarian Lola Dare.
I'm inviting you to keep watching SOUQ News. It's the right station to tune to.
I like SOUQ News. SOUQ News is good.
I want to charge you all to listen to SOUQ News, watch the news.
You can have unlimited news, first time.
Find SOUQ News. Be with SOUQ News. Never switch off. You are better for it. SOUQ News is the real thing.
Listen to their coverage and you'll be glad you did.
Turn to your YouTube, turn to your Instagram, turn to all your digital channels and look for SOUQ News.
Keep watching.
Keep watching.
Please, guys, keep watching
SOUQ News.
Hello Lagos, make we yarn.
Hello, Wefi, this POS matter, don't pass your code. Person go swipe, alert no enter. Before you know it, jump.
Wait oh, wetin really happen?
Then they use fake alert, the warriors.
Okay, so mona listen to If you dey do POS business, no expose your alert.
Hello, Wefi. They don't walk that road where they warrior for that local government for years.
This one sweet me, I no lie you. Because you know what, development wey dey work, it deserve loudspeaker. Now why we dey here be that? For here, we no dey abuse, we dey bring solution. My name, it is Ikechukwu Oyemike, aka Ogwefi Ishegwari.
Make we yarn every weekday from 10 a.m. go reach 12 o'clock on Top the Eye 95.9 FM.
Wale Soyinka, born Akiwande Oluwole Babatunde Soyinka on July 13, 1934, in Abeokuta, Ogun State, southwest Nigeria, stands as one of Africa's most celebrated literary figures and a global icon of resistance against oppression. His life and works reflect an unwavering commitment to justice, culture, and the transformative power of art. Soyinka was born into a Yoruba family in colonial Nigeria, an environment that exposed him to both traditional African culture and Western education. His father, Samuel Ayodele Soyinka, was a school headmaster, while his mother, Grace Eniola Soyinka, was a devoted Anglican. This blend of indigenous and colonial influences deeply shaped Soyinka's world. Soyinka attended Government College Ibadan and later proceeded to the University College Ibadan, where he studied English and literature. Soyinka completed his education at the University of Leeds in England, earning a degree in English and later a doctorate degree. In the late 1950s, Soyinka began working as a dramaturgist at the Royal Court Theatre in London. However, his passion for storytelling and cultural preservation drew him back to Nigeria, where he founded two theatre groups known as the 1960 Masque and the Orisun Theatre Company. Soyinka's works, often a fusion of Western dramatic techniques and African themes, address universal issues of justice, freedom, and human dignity. His early play, titled A Dance of the Forest, which was introduced in 1960, written to celebrate Nigeria's independence, critically examined the nation's socio-political trajectory, setting the tone for his career as both artist and activist. Soyinka's activism became more visible during Nigeria's post-independence years. In 1967, during the Nigerian Civil War, he called for a ceasefire between federal forces and Biafran separatists. This led to his arrest by the military government, and he spent 22 months in prison, where he wrote a short drama titled The Man Died, Prison Notes, a harrowing account of his imprisonment and a profound critique of authoritarianism. Soyinka has authored more than 20 works, including plays, novels, poetry, and essays. In 1986, Soyinka became the first African to win the Nobel Prize of Literature, an achievement that brought global recognition to African literature. Soyinka remained an outspoken critic of oppressive regimes, often at great personal risk. His activism extended beyond Nigeria, addressing global issues of injustice and human rights. During periods of military rule in Nigeria, he went into exile, continuing to write and speak against tyranny. Today, Soyinka is celebrated not only as a literary giant, but also as a symbol of resilience and moral courage.
shadows bend. The earth whispers tales, the wind.
Human rights are a fundamental and universal entitlement belonging to every person by birth, designed to ensure dignity, freedom, and equality regardless of race, nationality, or status. These inalienable rights form the very core of global governance. International human rights law, founded upon the Charter of the United Nations and the Universal Declaration of Human Rights, UDHR of 1948, establishes the binding obligation of government to protect these freedoms. A key success of this universal framework has been the continuous expansion of its legal body to protect vulnerable groups, including women, children, and persons with disabilities. This universal commitment forms the basis of this year's International Human Rights Day theme, Our Everyday Essentials, which seeks to reaffirm these principles not as abstract concepts, but as the practical foundation people rely on daily. Despite the strength of this legal foundation, challenges in implementation and new complexity result in an uneven global landscape. Millions are facing a critical lack of access to basic needs such as food, water, health, education due to persistent poverty and entrenched inequality. Recent World Bank estimates indicate that approximately 817 million people are currently facing extreme poverty, underscoring the severity of this implementation gap. Rapid advances in technology and digitalization also present novel hurdles concerning surveillance and privacy. Digital access, essential for modern civic participation, saw significant disruption in 2024 with 296 instances of internet service disruption, highlighting the growing threat to digital rights. This challenge is compounded by weak governance and the widespread persistence of armed conflict. These elements undermine fundamental rights by fueling instability and violence, often perpetuated by a lack of accountability for violations. The devastating impact on civilian life remains profound. The United Nations recorded a sharp 72% surge in the loss of civilian life in conflict zones in 2023, coupled with a record high of over 120 million forcibly displaced persons by the end of 2024. The human rights framework faces compounding issues such as climate change, which threatens the rights to life and health through environmental degradation. This has created a hazardous environment for advocates, with environmental human rights defenders facing substantial risk to their personal safety. Navigating a fair and constructive way forward requires key action across key primary fronts. Strengthening social safety nets through the establishment of universal social protection floors is vital to close the inequality gap and safeguard essential economic rights. Enhancing accountability is paramount. The international community must increase support for mechanisms that investigate and prosecute serious violations of humanitarian law, thereby countering impunity and restoring the rule of law. Also, the protection of civic space must be prioritized by regulating the digital sphere to ensure strong privacy rights and by enacting specific legal safeguards that protect activists, journalists, and human rights defenders from attacks, allowing them to perform their essential work without fear. Ultimately, ensuring human rights remain an ongoing commitment that demands measurable action over rhetorical assurance. by reinforcing the UDHR's principles through strategic investment in social protection, accountability, and the safeguarding of civic and digital freedoms. The global community can successfully transition these values from legal ideals into the everyday essentials that defines a life of dignity, freedom, and equality for all people. Praise Matthias, SOUQ News TV.
And the rules hold the reasons why.
My name is Becky Elijah. I'm from UBA, so keep watching SOUQ News.
Hello, my name is Emmanuel. Keep watching SOUQ News.
Esther Ashimi, keep watching SOUQ News.
Keep watching SOUQ News.
My name is Helen Otongwa. Keep watching SOUQ News.
My name is Okayemi Temiyemi. I am an entertainer. I am representing Egypt, as you can see. So keep watching SOUQ News.
Hi, my name is Nena Okavi. Keep watching SOUQ News.
My name is Tom Aldo. Keep watching SOUQ News.
I'm Elizabeth from POS Services UBA. Keep watching SOUQ News.
Hi, my name is Kelechi Agu. Keep watching SOUQ News.
We're going to have increase in the number of facilities that we would visit in the year 2025 by 30%. That would have improved compliance and enhancement of data-driven decision making using data analytics. We're going to strengthen collaboration between our partners, and we're going to have 25% increase in our compliance rates by carrying out the key strategies. We want to expand our monitoring coverage. We want to enhance our digital infrastructure by integrating a secure online pathway. We also want to include the e-learning platform and our mobile platforms on the digital infrastructure. We want to strengthen our community engagement and build capacity of both the farmer staff and our partners. We want to drive innovation and research. This year, we want to carry out research on quality of care. In doing all of this, we want to make the health facilities in Lagos safer by leveraging on technology and ensuring that all our processes are data-driven. Thank you very much.
Thank you very much, Dr. Onoriede, Dr. Nibo Shinowo, Dr. Veronica Iwaimi, and Dr. Abiola Idowu. Your Excellency, the Governor of Lagos State, Mr. Babajide Olushola Sanwo-Olu, the Honorable Minister of State for Health, Dr. Isiaq Salako. Taking us further in the comparative study, I want to especially welcome a professor and consultant medical parasitologist at the College of Medicine, University of Lagos. He coordinates the International Malaria Microscopy RDT Quality Assurance Center, as well as the country's World Health Organization malaria specimen collection sites in the College of Medicine, University of Lagos. Ladies and gentlemen, please let's put our hands together for Professor Wellington Oyibo for a very short comprehensive study. Thank you very much.
Thank you very much, His Excellency, Executive Governor of Lagos State, the Honorable Minister of Health, here represented here by the Minister of State for Health. Ladies and gentlemen, first of all, this is historic for us. This is a path we have planned, prayed for, and we are happy that this is happening. Mr. Governor, thank you for all you do and for making this happen myself. I'm so happy and grateful to the Honorable Commissioner of Health. He has told the story. So I'm going to build on those stories as I make this presentation. I don't have much time. And part of the whole thing is the advances that Lagos State has made for over 2 decades. The world is hearing it, and then the signature of this project through the impact project itself, which is calibrated around the impacts that this project will be again for Lagos States. My slide, please. So what we know about malaria, in the 15th century, why was it called malaria? It was called malaria because the cause of that fever illness was not known. And it was connected to marshy waters. So malaria in Greek is foul. And that was all they could do. And it took some another 100 years before it was connected to mosquito bites. And today we are talking about fever and say all fevers are malaria. So are we going to the 15th century? And this is what we're trying to really unbundle in Lagos as 16 over 15 million people. My slides. So if fever is still malaria, we go back to the 15th century. And then, of course, for evidence base, meant that we will have to quickly provide the evidence. Yes. So the horrible complaint of school is out from here. So I've given this background. Most health workers will not accept the test results when it's negative. And that's the challenge. Next slide, please. Okay, and if you don't have data, which we are talking about digitization, you cannot calibrate where you are. And so if we look at the entire program and the plan of the projects, is to see that real-time data is available and that tests are done. And when the test is done, we can say quickly, cost-effectively, this is where we are. Because you can get the line on routine data. The country do not have quality data, and that's the challenge. Next slide. So, low confidence in the test. Basic things are being used. Lagos is making progress. How do we handle this? 94 to 96% of the reporting for malaria in the DHIS that categorizes states and Nigeria comes from the primary healthcare center and is from the public sector. It's important to recognize this. Next slide. And we're bringing this on board because we provide the quality platform for quality diagnosis at the College of Medicine. Next slide. And we do all of this carefully to ensure that these tests are good to be used for humans. Next slide. And what is known? Please just keep on going on the slide because I'll just look through them. There are changes in Nigeria in terms of malaria epidemiology. Next slide. And then we see from the 2021 malaria indicator survey where Lagos is. Next slide. And you can see where we are here at 2.6%. Hopeful. And next slide. Good progress. And we're talking about the path for pre-elimination. We are on that path. And we are happy that this is being mentioned here today. And like I said, this signature. And in line with the stratification strategy and subnational tailoring by WHO. So we are quite on course on this. Next slide. And then you can see the different tests available. You can keep on hitting enter. You have microscopy that is powered by a human being. And then you have this rapid diagnostic test that is technology. But somehow we refuse to accept technology and we stay with humans with all the challenges. So that's what you see with microscopy. Just keep on pressing enter. And all of this, and this is the test within minutes, the result is out. The other one will take any time. It will be 1 day. And then based on that, we have done the scoping assessment of facility in Lagos.
Recent times, cosmetic clinics. So we're finding it difficult. We have limited capacity to ensure monitoring of these facilities. We also have inefficient manual processes because our digital platform is unable to carry out some of the processes in the agency. We're sitting on a lot of data in the agency,
with AI to make sure that the test is actually having the results that the pharmacy or PPMB says it does. We then verify that the appropriate treatment. And then in the impact program, we have to the public health system for malaria-negative patients to ensure that they're getting the proper diagnosis that they need and have a better understanding of what other febrile illnesses patients might have. Next slide, please. Next slide. Okay, so I'll just talk briefly about all of the other partners that are working on this as well. So we are working closely, of course, with the Lagos State Ministry of Health, which envisioned this work and brought us in to support on this. With NMEP, which is overseeing the work and providing technical oversight. With WHO, which is providing, again, technical support and facilitation. And then importantly, with our private sector partners as well. So PCN, which is doing quite a bit of the regulatory oversight and ensuring the quality of care in a pharmacy setting. With SFH, which is enabling the supply chain. And then, of course, with LASHMA, which is to go quickly into the final results on why this is improved quality of care. Oh, okay. Sorry about that. So the work is providing network expansion, innovative financing, integrated health systems, supply chain resilience, comparative research, and regulatory reform, leveraging all of these different partners that we've mentioned to ensure that patients are able to access quality care and that the data is being provided back to Lagos State to help improve regulatory support, policy, and other things. I mentioned the partners that we have here already, but we're very grateful for all of the work that they are providing to ensure that there's quality of care in the private sector. And then finally, one final slide. To reinforce what Dr. Wellington said earlier, the work that is being done is also to be supporting with testing, understanding the difference between rapid tests and microscopy, to support on policy reform to ensure that rapid tests are always done before treatment for malaria in Lagos State. Thank you all so much, and we're very excited to be a part of this.
Thank you very much, Dr. Jessica Venon, the CEO, Meds. Ladies and gentlemen, taking us further, Nina Obulafo. Thank you very much.
Thank you very much, sir. Your Excellency, sir. We're very happy that this is happening today. So just permit me to do something unique in terms of our focus for malaria control in Nigeria. To do this, I will call on Dr. Dao, Country Director for Malta. We're going to have the Honorable Minister being tested for malaria. Honorable Minister, please. Thank you so much. This is showcasing the main focus for malaria control in Nigeria, which we refer to as the 3 T's. Your Excellency, the first T stands for tests. We cannot overemphasize or we cannot underscore the importance of that. The second T, sir, is for treatment. cannot have His Excellency and the Minister of Health standing for long, so once we take their samples, we're going to have them seated again. Dr. Walter on stage to come and quality check what is happening, sir, please. Thank you very much.
We are witnessing leadership by example. Leadership by example by Mr. Governor, Mr. Babajide Olusola Sanwo-Olu, as well as the Honorable Minister of State for Health, Dr. Salako. Please, let's appreciate them. That is the way to go for every one of us all.
Thank you very much, Your Excellencies. So again, this is the way to go for malaria control program in Nigeria. The pre-elimination in Nigeria could commence in phases. We could commence pre-elimination in Nigeria in phases. Thank you, Your Excellencies. Thank you. So back to the fourth bullet on my slide. Your Excellencies, pre-elimination in Nigeria could be commenced in phases. It could start with the states, Lagos State, for example, and we could go geopolitical zones. So I was sitting with my sister, the Commissioner of Health from Ogun State. So the fever for pre-elimination have started. So I also want to say that it stands on Lagos State to make sure that this pathway for pre-elimination is properly done. The National Malaria Elimination Program is waiting to take the experiences and the processes that Lagos will use to achieve elimination to be replicated in other states. Your Excellencies, it's important to note that right now we have a couple of states under 10% prevalence in the country, and those states are Anambra, Kwara, and Rivers State. So what is happening in Lagos that has been flagged off today, it's like NMEP, it's poised to take what these processes and experiences are to states like that. Thank you very much.
Thank you very much, ma. Let's appreciate her. Thank you very much. Thank you very much. Mr. Governor, sir, Minister of Health and Social Welfare, Professor Mohammed Ali Pate, who has been ably represented here today by the Honorable Minister of State for Health, Dr. Isiaq Adekunle Salako. A round of applause for him, please.
Your Excellency, the excellent Governor of the Center of Excellence, Mr. Babajide Olusola Sanwo-Olu. I must recognize my brother, who is one who has summoned all of us here today, the Honorable Commissioner for Health for Lagos State. All members of the Lagos State Cabinet here present, our partners, WHO, World Bank, distinguished stakeholders in the health sector, gentlemen of the press. Because of time, let me say all protocols to be extended. We cannot keep the governor for malaria alone. He has to attend to water, to road, several other things, so I will shorten my speech But I must say that today I'm wearing two caps. You may not see it physically. Standing in for myself and also standing in for my brother, the coordinating minister for health and social welfare, Professor Party, who is unable to attend because of other assignments. I am most delighted to be at this auspicious occasion of the launch of the Pathway to Malaria Pre-Elimination and Digitization Program in the Center of Excellence, Lagos State, led by His Excellency the Governor, Mr. Babajide Sanwo-Olu. I recall that Lagos State pioneered intensive malaria case management in the early 2000s through the Eco-Free Malaria Initiative under the leadership of now our President, President Bola Ahmed Tinubu, the then governor. I am most delighted to be here today to be part of another pioneering initiative now under Governor Babatunde Sanwo-Olu as Lagos State takes the lead in the agenda to end malaria by 2030. Your Excellency, the Federal Ministry of Health and Social Welfare is elated with this giant stride, which aims to improve malaria diagnosis, case management, and accurate tracking of cases through the integration of digital health solutions in the form of real-time electronic reporting systems, all targeted at further reduction in the burden of malaria and its eventual elimination from our land. This momentous project will not only set the track for malaria pre-elimination in Lagos State, but in Nigeria at large, thereby once again making Lagos State a trailblazer. I want to emphasize that this project is in line with the renewed hope agenda of President Bola Ahmed Tinubu and the renewed vigor for the Federal Ministry of Health and Social Welfare on the rethinking malaria concept that was launched in April 2024 and is aimed at fast-tracking the malaria elimination goal through strategic shifts. We have continued to make progress in this regard, and the inauguration of the advisory on malaria elimination in Nigeria, Amen, the development of pragmatic costed plan of action, the expansion of permanent care facilities, training of frontline health workers, and the initiation of domestication of affordable medicine facilities for malaria to make malaria treatment more affordable are all testament to the progress we are making. Your Excellency, distinguished ladies and gentlemen, the Ministry is taking these steps in order to reverse the undesirable trend of being the highest burden malaria endemic country globally, accounting for 37% and 31% of cases and deaths respectively. I am confident that Lagos State possesses the needed attributes that can help drive Nigeria to malaria elimination through such case-setting initiatives like this program. Furthermore, Lagos has consistently been the lowest malaria prevalence state in Nigeria, as evident from all the malaria indicator survey conducted in the country, with the most recent result in 2021 showing 2% prevalence, hence indicating a tendency of attaining pre-elimination when concerted and consolidated efforts are put in place. I wish to report that the challenge of let me use this opportunity to call on all stakeholders not to relent on their support towards this impactful intervention, which will contribute significantly to the drive at eliminating malaria from the world. Nigeria is ever committed to this drive and we will continue to toe the path of global best practices. I wish to assure all Nigerians and our partners that the change in the policy of the United States government with respect to global health funding will not adversely affect our malaria elimination programs and other public health initiatives, as President Bola Ahmed Tinubu GCFR has approved a robust mechanism to ensure adequate and cost-effective funding for our public health programs. I call on all state governments to join hands with the federal government to ensure that our country becomes self-sustaining in the funding of our public health programs. Before I end this address, let me commend once again and appreciate His Excellency, the Governor of Lagos State, Mr. Babajide Sanwo-Olu, and his health team, led by Professor Akin Abayomi, for initiating and executing this laudable innovative project. I wish to also sincerely appreciate all the partners, World Bank, WHO, all the implementers, especially for providing the needed human resources, technical support, and the funding for the implementation of this initiative. I wish all of us a successful launch of this impactful project as a springboard for the elimination of malaria from our country. Thank you, and God bless the federal government.
Distinguished invited guests, Your Excellencies, Minister of State, have your results. To say that Honorable Minister of State, we will not be confining you in a bed in Lagos. Your result is negative. When patients go to clinics and the doctors tell you that they've performed the test, it is your responsibility as a patient to see the test. Please ask for the test and take a picture of it and have a record on your phone. My Governor, the Excellency of Lagos State, I'm pleased to tell you that you may continue with your duties.
Congratulations, sir.
Negative, in line with the low prevalence of malaria in Lagos as well. Chart a course to fully elimination. Thank you very much for your support, both the Honorable Minister and our Governor and members of the Lagos State Executive Council. Mr. Governor, if you would like to approach the podium to give your keynote and to launch a pathway to malaria elimination in Lagos.
Practitioner himself and a strong politician, Dr. Thank you very much for finding out. Members of the State Executive Council, especially Professor Akin Abayomi, and Special Advisor on Health. Thank you very much. Other cabinet members, all the permanent secretaries in the Health Ministry, and several of you that are here. Thank you very much for taking our time. The Country Director for the World Bank, Dr. Diop, the Country Representative for the WHO, Dr. Walter, all of our partners that are here, MyShamed, Impact, SFH, the National Malaria Organization, our friends from our neighboring state, the Honorable Commissioner for Health in Ogun State, thank you. All of our health practitioners and stakeholders that are here, gentlemen of the press, ladies and gentlemen. When you are asked to come forward and conduct a test that you did not psych yourself for, what will happen is you quickly raise, your brain will raise back and say, have I been feeling unwell? What is going to happen? It just brought us back 5 years during COVID, and they said that they're going to do a COVID test. It was like, the heart was going to open and you don't know what will be the outcome. But you see, it's an important activity that we need to continue to subject ourselves to. You might think it's a simple thing, but it's so important. And that ability for you to come forward, if it has turned positive, what it will have just meant is that we need to make a treatment. It's not a death penalty, but it is really just for all of us to know that we need to do this thing and we need to be able to come forward transparently at all times and let us end all of these things that we don't want again in our sight. Thank you very much. And so it's an honor therefore, all of you in this room are very strategic to launch the first in the country, another Lagos first, the pathway to malaria pre-elimination and digitalization program. We're here to affirm our commitment to safeguarding lives and the livelihood of every Lagosian. Malaria is more than a disease. It's a social-economic burden that has held back individuals, it has held back families and communities for such a long time. It robs us of our productivity, it drains us of our household incomes. And for many households in Lagos, especially those modest earners, malaria, the name it alone brings shivers. It reduces their earning and reduces their ability to continue to earn more for their family. And so this financial strain often affects families and a lot of times causes heartbreaks and the rest of it. But we're here to put a stop or to even bring a voice to the step at which we want to eliminate that completely. It has affected school children from going to school, it has affected businesses, it has seen a whole lot of absenteeism and a lot of challenges in our society for several decades. But today, we had to change all of that narrative. The eradication of malaria is not just a good health news, it is indeed an economic imperative. It's a good news that all of us must beat our chest and be able to carry, if there's a P, that we need to have, a pre-elimination, the campaign for it, we need to have it and we need to be able to dot it everywhere. We know from statistics how much malaria has cost our GDP, billions and billions of dollars. Imagine what Lagos could achieve with a lot of resources if we're able to eliminate all of this. We no longer have to choose between survival and opportunity. Imagine a Lagos where every child can attend school uninterrupted because of ill health, or an adult can contribute fully to the economy. And one thing that is instructive was the demonstration of the slide by Professor Akiambam, and I saw others as well. I can see that Prof already has a side job. Animation and cartooning is a job that he can conveniently retire into. And the narratives were very clear. But the message was very, very transparently done. And all of us, in one form or the other, are guilty of this. You feel unwell, you think you have a fever, the next thing is you are diagnosing yourself with malaria. Very easy. Just give me injection. Just give me this tablet. I know what it is. We are all, self-diagnosing ourselves and self-telling ourselves that that is what it can only be and that is what it is. So just give us. But we can see that with knowledge and with communication, a lot of all of those negative things we can rewrite them. And so this program represents a hope rooted on innovation, collaboration, and determination by leveraging digital tools that will ensure that every malaria case is tracked in real time. This is digital. Long are those days when you need to take a whole full blood from your body to just do a simple malaria test. I was asking for my bottle of Mortina because those days when they take your blood test, they must replenish it with a bottle of Mortina. But you can see that with just a small prick, and in no time you can actually. That's what digital life, has done. And so it has helped us by strengthening partnership with the private sector. We will expand access for quality care. It will help communities to have the knowledge and resources. It will build a culture of preventing that leaves no one behind. And that's a message we need to come out of from here. All of us sitting in this room must immediately turn ourselves into an advocate, into a cheerleader, to be able to carry this message forward, to be able to tell everybody that needs to know. Go into our communities, pass on this message that this pre-elimination launch program has started, and it's for all of us to see it, to buy into it, and to work with it. The benefit of eradicating malaria goes beyond just health. In malaria-free Lagos, and indeed in future, in malaria-free Nigeria, it's achievable in our time, and we've all put our minds to it. It's something that could be done. We believe that if we can eliminate it, it will increase productivity, it will improve educational outcomes from our children, it will reduce considerably our health costs. It would also enhance quality of life. I mean, all of these points speaks to a better livability standards, in all indices. And so this vision, though ambitious, I believe is achievable. It's because, therefore, all of us, government agencies, healthcare practitioners, healthcare providers, community leaders, development partners, and indeed all citizens, to work together with an unwavering resolve. Success will not come overnight, but will be sustained effort and collaborative action. We will prevail. You saw the slides that a farmer and the lady on malaria and the lady on immunization. You saw the statistics between January and February, what the run rate should be. Yes, we will say that, this is just March, but we need to look to double those numbers. We need to push those numbers to be able to achieve the 2025 target. We need to be able to push and achieve, because there is no magic to it. If your target is 2 million, and at the end of February we are still doing less than 200,000, you are doing far less. So you need to double, your spike shoots. You need to work harder, twice as fast, twice as much, for you to achieve the 2025 record. And Doctor told us, Prof, he told us from WHO that it's 2025, they are going to close the envelope. Hello? Yes, you said they are going to close it. And there's a 20, where is it? I thought it was, they're going to close it. Our target is that we'll have to take that $20 million. We'll have to do everything to make sure that we'll meet the criteria very quickly. Because if it's something that we've all said we want to do, then everybody must be on the same page. And I want to commend the farmers and all the ladies that came forward.